Hello and welcome to Healthy Living with Dr. Judy. Today I'd like to help clarify the difference between a medical doctor, a chiropractor, and a massage therapist, and physical therapy. So oftentimes patients are confused, especially chiropractor with massage therapist. A massage therapist are not doctor. They are a part of the healthcare provider, but they work specifically with muscle, with relaxations. Um, and they will need to get a referral from a doctor, like a chiropractor or a medical doctor or an osteopath or a naturopathic doctor. So massage therapists are not chiropractors. Chiropractors are doctor. The difference between a medical doctor and chiropractor is that medical doctor are trained to prescribe medications for specific conditions. And if those medications doesn't work, the last resort would be surgery. Whereas chiropractor are trained to look at the human body as a whole and to understand the nervous system, because that nervous system controls all functions of the body, from our ability to speak, to smell, to see, to hear, to move our hands, our regulating our hearts and lungs and all. That is controlled by the nervous system, the central nervous system, and the autonomic nervous system. So the autonomic nervous system controls our visceral organ as well. So um, our training differ in that aspect. And in chiropractic, we believe that the spine houses most of the conditions that patients have when the spine is out of alignment. And Hippocrates, also the father of modern medicine, says, look to the spine, for it houses many diseases. And that is the case with when we understand the spine. So take, for example, a healthy, normal spine have a nice curvature in the neck area, and the neck in chiropractic or medical term, we call that cervical. And they have 7 bones along this neck area. And each neck has a hole that comes out of it, what we call the foramen. And it is very important that that foramen maintain its normal structure, because when it's compromised, we have nerves that comes out to supply the hands, but also there's blood supply that comes out in different parts of the area of the neck, also to come supply the brain and then the hands. So the structure of the neck is very important. So 35-degree is the normal healthy structure. And not only that, it also affects the disc of the neck. So most patients who have neck pain, shoulder pains, headaches, and all of that may have a lot to do with the structure of the neck bone. And if you take an x-ray, most time patients will lose the structure of the cervical, and they will, if you'll see, every time when we compromise the structure, it compresses the disc, but it also narrows the foramen that's coming out, that's supplying the nerve to the area of the upper extremities. So there are many factors in the cervical, but also the cervical affects our visceral organ as well, with our breathing, with our heart regulations, and because the vagus nerve comes out just right where the occiput and the so right behind your ear. And also is our breathing nerves that exit out through the cervical as well. So that impacts our health and well-being. And then in the thoracic, there's a nice 45-degree curve, and it has 12 bone. We call that um, T, or thoracic. And then the lumbar has a good 35-degree curve. And it has its, the reason why it has this structure is that there's a purpose for its functions. It's a standing harmonic. It tunes and regulates the flow of the nervous system, but also there's a cerebrospinal fluid that is being produced in the third ventricle of the brain, and then it basically just power the spinal cords. Um, so when we lose the curve, you can see the disc here. As we lose the curve, it compresses on the disc, but it also narrowed this foramen as well. So when this foramen is narrowed, it basically constrict the nerve flow. So it's like having a water flow when your water hose is turned on and then there's a kink in the hose, or um, you're stepping on the hose, the amount of water flowing is diminished. Well, that's the same thing with the nerves when it is being impinged because the structure is out of alignment. And so getting regular chiropractic care help to maintain the flow of the nervous system to function at its optimum. Because when it is being uh, out of alignment, the structure, the human structure is out of alignment, it compresses on the nerve, and then the blood supply as well, because we torque the bone out of its position and then causes the muscles to tighten up. So if we only get massage, we're only working with the muscle, and it's the bone that really takes the pressure off of the nervous system. So when the bone is out of alignment, it basically torques the spinal nerve flow. So we work with the human frame to make sure that the body maintain its normal structure, and assist the body when it is not, through adjustment. And that's where we are trained to look at, is that the root cause of the condition that the patient comes to present to us. For instance, with shoulder pain, patients would come in with frozen shoulder. I would assess, is it structural? Is it visceral? Is it emotional? There's many factors. So through our observations, palpations, and differential diagnosis, if we need to do x-rays to rule out any fractures, any um, tumors, any cysts, these are the things that we do to help the patients go to the root cause of the conditions and find out. And without having to offer any medications or surgery, because we understand that when we can assist the body to flow in balance and in harmony, our body has that natural ability to self-regulate and restore its balance. And that's all that the body needs. So the difference again is that as a chiropractor, we work with the human frame, the human structures, the nervous system. And that nervous system control every functions of our body, from the visceral organs, from the heart rate, cholesterol, blood pressures, sight, eyesight, hearing, um, everything that the human body is encompasses. Chiropractor work with them, because if they are out of balance, say if your heart rate is high, your blood pressure is high, that means the nervous system is out of balance. So when we work with the body, we don't say we're working with your blood pressure or your high cholesterol or any of that, because we understand that the bigger picture is to balance the nervous system. And when we balance the nervous system, then the body will then self-regulate itself, and then the blood pressure will be restored, the heart rate will be restored, and the blood sugars and all that, because the body is not under stress of this fight flight trying to survive. The body will come into this calm relaxing state of parasympathetic rest and digest. So this is the goal of chiropractor, is to help patients when they come in with pain with certain conditions. We're not treating the condition, we're working with the patients to restore balance. And our goal is to find that root cause and then help the patient understand it and restore that balance, and then they can go back to live um, and achieve more of an optimal health and well-being. So every patient, every person who have a spine, have a nervous system, that needs to be checked on a regular basis, because our day-to-day activity put us out of alignment. So the most common is birth trauma. So when the baby come out of the birth canal, the head is torqued and being pulled by the physician. And so if it's not properly checked, then that baby will have some sort of injuries unnoticed until a certain age group, and then they start developing, having problems and whatnot. So those are the most common. That's why pediatric chiropractic is well known to those who are very versed in chiropractic. And chiropractic care is offered globally. All 50 states in the United States, chiropractors are licensed as a doctor, and internationally as well. So if you have not seen a chiropractor and have not had your spine evaluated and assessed, and is living with chronic pain, highly recommend that you go in to see a chiropractor who can help you understand more about your body. Oftentimes, I get patients who have tried everything and nothing seemed to help. And with a few chiropractic visits, they are able to restore their health and well being again. So, especially with chronic pain patients, I've seen a lot of chronic conditions, and I specialize in that as well. We know that traditional medicine, modern medicine, cannot or do not have a solution for chronic pain. And chronic pain is projected to grow by 2030, another 6 to 7% at a minimum. So that tell us that, okay, there's no solutions for chronic pain, but uh, I believe that the majority of patients who are suffering with chronic pain of 5, 10, 20, 30 years is because they haven't been exposed to a different type of care. Their only way of understanding how to get care is through medical, and that is drugs, medication, pain medications, or surgery. But that is not the only solution. There are many different alternatives to looking at your condition. And having a chiropractor to be a part of your healthcare team, so you can have your medical doctor, you can have your dentist, you can have your um, different providers, but also have chiropractors in your healthcare team, will really add a tremendous benefit to your overall health and well-being. So I hope that this video helped to clarify the difference between a chiropractor, a medical doctor, and a massage therapist. Again, massage therapists are not doctors. They work with muscles, And chiropractors is not massage therapists. We are doctor. We can diagnose, we can treat. Our philosophy is that the body has the innate ability to heal itself if we can take the obstacle that blocks the flow of the nervous system. So, our goal is to restore and maintain a healthy flow of the nervous system so that it can keep us healthy and strong. And medical doctor, on the other hand, would prescribe medications or do surgeries. All right. So I hope this video helps you to understand a little bit more about chiropractors. And if you have not received a chiropractic care before, highly recommend that you seek one in your community, somebody that you could trust. Talk to people that you know. Who do they go to get their spine aligned? All right. Thank you so much for taking the time to watch this video. If this is helpful, please click like. And if you'd like to hear or learn more about any topic, let me know. I will put out a video. All right. And if you have not subscribed, please subscribe. Thank you.